Hi, everyone. Welcome back to our weekly Stats with Sara report. My name is Sara Wilton, epidemiologist here at the Jefferson County Health Department. Today, we will be reviewing the COVID-19 data for CDC week 31, which is the week starting July 25th, ending August 1st. We had a total of 313 lab-confirmed and probable COVID-19 cases, which brings us to a year-to-date total of 1,462 cases for Jefferson County. Our total COVID-19 associated deaths remain at 25 as of week 31. We now have 12 outbreaks within our long-term care facilities, which is another increase from week 30. As always, we will review the data excluding those long-term care facilities later on after we review the data for the county as a whole. Let's start off today by looking at Table 1, which shows our weekly numbers of lab-confirmed and probable COVID-19 cases along with the cumulative totals. We had 313 cases, which was a 22% increase from the week prior, and it brings us to a total of 1,462 cases since March. Taking a look at Figure 1, we are able to visually see just how those weekly case numbers are moving. Jefferson County is still seeing increases as we move from week to week. As a reminder, the numbers that we report for positive and probable cases here do not include duplicates. For example, if you know someone who has tested multiple times and maybe tests positive 2 or 3 times, they're only counted once on our list. Things may change as we get further down the line, months from now, and new research is available on the risks and the chances of secondary COVID-19 infections. But as of right now, we are only counting each positive case as one, even if we receive multiple lab reports from different dates for the same person. In Figure 2, we can see the cumulative COVID-19 weekly case count. The solid blue line shows our cumulative case numbers as time progresses, and that dotted blue line shows our trend line, which is still moving upwards as well. This week, I added a new graph to help smooth out those daily case numbers and show a better view of what's going on with our positive cases. So this chart shows the daily case count and a 7-day rolling average instead of the 3-day rolling average like we used to have. That dotted line shows the number of daily new cases, and the solid blue line is that 7-day average. So this helps account for any fluctuations in the data, such as fewer cases being reported on certain days, or those days where outbreaks are reported. Figure 4, we have the confirmed and probable cases according to age group. Once again, we see the highest number of cases in our 20 to 29-year age group. They had 74 new cases from week 30 to week 31. Our 80-plus age group saw a pretty high increase as well. However, almost all those cases were within our long-term care facilities. So we will look at those numbers a little more in depth in just a bit to give you an idea of the number in our community when we take out those cases that are in the long-term care centers. Next, I want to touch on those hospitalizations and the hospitalization rates. For those who watched the Facebook Live on Tuesday evening with our director, Kelly, she explained that we are working with the local hospitals to gather data directly from them in order to get more accurate info for you all when it comes to the hospital data. Right now, we rely on the residents themselves reporting information to us, so there is always a chance for some error. We know that the hospitalizations and the morbidity and mortality rates are something that a lot of our residents are asking for, and we want to make sure that we are giving the most up-to-date and accurate information that we can for you all. So this week, we still have that resident reported data for our hospitalization chart that you see next. Our highest numbers that are being reported are within our 60 to 69-year age group. During week 31, our fatality count did not change. If you follow some of the numbers in the reports on our socials, you might have noticed that there were 3 more deaths reported to us recently. My report here is from week 31, so that only includes data up until August 1st. You'll see the fatality numbers updated when I review week 32 data with you all next week. As of week 31, though, Jefferson County was reporting a 1.71 fatality rate. This is below the Missouri and the US fatality rates at this point in time. I want to take a look at our lab confirmed cases in figure 9 next. This shows the weekly PCR test results, which once again does not include the antibody tests or our probable cases. When we are looking at just the lab confirmed cases, we are still seeing a fairly steep increase as of lately. Something many residents are asking for is the percent of positive cases. And this figure is where you can see how many tests were positive of the total amount of tests that are taken for our county. That dark blue dashed line is the percent positive. And on the next slide, we'll be able to see the actual test numbers. So here is table 3. This is where the actual values of those positive and negative test numbers are shown. We had 296 positive tests reported for last week during week 31, which is an 11.9% positivity rate. One thing I do want to mention as far as these specific numbers go is that we do receive some negative test reports after we have published our weekly surveillance report. So if you ever do see some of these values slightly change from the week prior, it could be due to a small delay in those negative test reports that we get back from the state. Usually this does not change our positivity rate significantly, but I do want you to be aware that I keep these numbers as up to date for you all as I can. Table 4, we see our COVID-19 cases by race and the rate per 10,000 residents. The white population still holds the highest number of cases with 1,209, but we can see that the rate per 10,000 in our Black population has increased since week 30, as well as the rate for the American Indian, Alaska Native population. Figure 11 is where we see our cases by zip code. The Arnold area 63010 had an increase of 115 cases from week 30 to week 31, bringing their total cases to 297. Festus 63028 sits at 206 cases. And the Imperial area 63052 had an increase of 48 cases throughout the past week, for a total of 194 cases in that particular zip code. It is important to note that some of these areas may have long-term care facilities in them, which is why we do that report for you all, where we exclude the long-term care facility data, so you can get an idea of the numbers that are essentially in our general population. When we look at that zip code data per 10,000 residents, you'll notice that the first 3 areas that we pointed out in the last slide, Arnold, Festus, and Imperial, are the same 3 areas that have our highest rate per 10,000. When we take rates, it helps to even out things a bit to count for those areas where the population may not be as large. This helps us when we're making comparisons among areas that have different populations. All right, I want to take some time to review the data excluding the long-term care facilities next, because we did see quite a few cases within this population during week 31. We had 261 lab confirmed and probable cases, excluding our long-term care facilities, which means that there were 52 cases last week in those long-term care facilities. Table 1 shows those numbers of confirmed and probable COVID-19 cases, excluding the long-term care facilities. The cumulative total minus the long-term care facility cases as of week 31 is 1,157. Figure 1 shows that weekly case count number You'll notice that when we exclude the long-term care facilities, we are still seeing quite an increase in cases, meaning that we definitely have community-wide spread at this point. Figure 3, we have that new 7-day rolling average chart again, this time excluding the long-term care facility cases. Looking at that solid blue line, which is the 7-day average of cases, you'll see that right around the beginning of July is when we started to see that uptick in cases that hasn't quite leveled off yet or slowed down yet. Figure 4 shows our confirmed and probable COVID-19 cases and age-adjusted case rates, excluding the cases within the long-term care facilities. Our 20 to 29 year age group still shows the highest number of cases with 251. This was a 39% increase in cases from week 30 to 31. While this group is continually showing the highest number in actual cases, a couple of other groups experienced high increases from week 30 to week 31, particularly the 0 to 9 year age group, who saw an increase of 46% since last week. And the 70 to 79 and the 80 plus year age group also experienced around a 53% increase in cases since last week. This percent increase just indicates to us that we need to keep an eye out for these particular age groups. Even though they aren't necessarily showing the highest physical numbers, the amount that they are jumping from week to week could become a concern. To finish up our data review today, let's look at the zip code data again in figure 10 to see our COVID-19 cases, excluding those long-term care facilities. Areas experiencing the highest number of cases are the Arnold area, 63010, Fenton, 63026, Festus, 63028, and Imperial, 63052. When comparing this chart to our zip code data from earlier, we see that even though those long-term care facility cases are excluded, the same zip codes still hold our highest number of cases. When we switch to the view that shows the rate per 10,000, things are much more evened out. So this takes the population of each individual zip code into account. And once again, this helps to give a fairer comparison of some of those areas that may have higher populations or smaller populations. A couple areas that have the highest rates per 10,000 at this moment are 63049, which is High Ridge, and 63052, Imperial. And that's all we have for you today for our COVID-19 stats. Thanks for watching our recap of the week 31 data. Stay safe, stay healthy, and be sure to stay in touch with us for the latest information and recommendations. Have a great night, everyone.